Good evening, folks. My presentation tonight, discussion D, weaves holistic care and geriatric care in intertwined section together for explanation, because I believe that the older folks, the older adults need holistic care integrated into geriatrics also, not just basic geriatric care. So here's my presentation I made for you all for tonight for D. So please enjoy. Here's a deeper synthesis that weaves together holistic and geriatric care into one unified, equity-driven framework designed with your systems thinking, participatory design, ethos, and cultural adaptation expertise in mind. Holistic geriatric care, a culturally responsive systems level synthesis. Holistic geriatric care is not just a model, it's a paradigm shift. It reframes aging from a deflect-based lens to one of potential dignity and interconnected well-being. By integrating the social, biopsychosocial, spiritual dimensions of health with the structural realities of aging, this approach offers a roadmap for inclusive, person-centered care that honors complexity and community wisdom. Foundational pillars: whole person orientation, moves beyond disease management to embrace the full humanity of older adults, recognizing their lived experiences, cultural identities, and involving aspirations. The geriatric 5 M's as a holistic scaffolding: mind, meditation, supports cognitive vitality, addresses dementia, depression, and delirium with culturally adapted mental health strategies. Mobility, promotes functional independence, fall prevention, and adaptive movement through community-based physical engagement. Medications, tackles polypharmacy and medication burden with shared decision making, and prescribing protocols. Multi-complexity navigates layered health and social challenges, including chronic conditions, trauma histories, and caregiving dynamics. Matters most centered, matters most centers care around personal values, spiritual beliefs, and culturally grounded goals. Emotional, cognitive, and legacy integration. Mental health as core infrastructure. Holistic geriatric care foregrounds emotional resilience, grief processing, and anxiety reduction, especially in contexts of loss, transition, and isolation. Life review and meaning making, incorporating culturally responsive legacy building, storytelling, and integration, intergenerational dialogue to foster purpose and psychological well being. Trauma informed adaptations recognizes historical, racial, and gendered trauma in aging populations, embedding safety, choice, and empowerment into every intervention. Cultural and community embeddedness, participatory design, and co creation engages elders, caregivers, and community stockholders in toolkit development, program design, and evaluation, ensuring relevance and ownership. Tailors interventions for marginalized populations, including rural elders, BIPOC communities, and LGBTQ seniors, using culturally grounded frameworks and language access strategies. Social connection as medicine builds networks of belonging through peer support, community rituals, and culturally meaningful activities that combine loneliness and foster engagement, implementation, and evaluation strategies. Modular toolkits and digital outreach deploys flexible and deploys feasible, scalable resources for caregivers and providers, integrating myth busting, culturally tailoring, and trauma informed guidance. Mixed methods evaluation uses quantitative and uses and quantitative tools to assess impact, refine adaptations, and ele- uh, alleviate community elevate community voice in outcome measurement, systems integration bridges clinical, policy, and social domains, linking holistic geriatric care to infrastructure improvements, workforce development, and reimbursement models. This synthesis invites a reimagining of aging care, one that's rooted in dignity, driven by data, and shaped by the voices of those it serves. If you're ready, we could co-design a framework that maps these principles into your current toolkit, initiatives, or community engagement strategies. Want to sketch out a matrix or build a case study next? Okay, guys, I'll be back on with E in a little bit to tie all this together for you. Okay, I have a few angles I want to do for another show, so I'll be back on shortly with that for you. For now, Gator Wellness, take care, folks.